Welcome to budget hearing on human services for our budget 2016. And we need to introduce ourselves again, so go for this time.
Zach Telerik, Director of the Office of Management and Budget.
Victoria Caldwell, Acting Clerk to the Board of Commissioners.
John O'Grady.
Marilyn Brown.
Paula Brooks, County Commissioner.
Kenneth Wilson, County Administrator.
Chris Long, Deputy County Administrator.
Lance Porter, Job and Family Services.
Joy Bivens, Job and Family Services.
Eric Janis, Deputy County Administrator.
Christy Russell, Assistant Director, CFO.
Matt Habash, MidOhio Foodbank.
Charlita Tavares, PrimaryOne Health. Jeff Marable, PrimaryOne Health.
Welcome, all of you. And we will get started with Job and Family Services.
Well, thank you, Commissioners. Good morning. I'm on the other side of the dais for this part of the
I
presentation.
know, I just saw you
Feels a
over
little
here.
strange. Commissioners, County Administration, my colleagues, OMB, citizens of Franklin County. My name is Eric Janis, Deputy County Administrator for Franklin County Board of Commissioners. And I'm here today to present the budget presentation for the Department of Job and Family Services. As you all are aware, I'm assisting with the department while you all conduct your search for a new director, and I'm happy to be here today. I have with me Christy Russell, Chief Financial Officer, Joy Bivens, Chief Operating Officer, Lance Porter, Deputy Director of Communications, and then in the back we have Amy, Mike, Laura, Michelle, and Bart Logan. Special thanks to Bart for helping in this presentation. Wanted to make sure I had everybody here in case you all had questions. So thank you this morning. We look forward to talking to you about our budget today, and I want to talk about a number of notable achievements throughout this past year. A year that certainly has had its share of challenges, and also outline some strategic initiatives that we see forthcoming in 2016. And that's all while we continue to strive to be a leader locally, statewide, and indeed nationally as it relates to health and human service issues. So I want to talk about some of our accomplishments for 2015 first. And the first one I want to identify or make comments about is our TANF workforce participation rate, and this is one that the department, very rightly so, is very proud of. 2015 has been a year of new highs for Franklin County in the cash assistance program. As you all know, the federal government requires that at least 50% of program participants take part in work activity or training programs. Last year, we set and achieved a goal higher than that of 60% in work participation, and we have maintained and exceeded that throughout 2015. Just this past July, we hit a new agency high water mark of 70%, and we finished the federal fiscal year with a cumulative rate of 65.5%. That's the highest of all the 8 large metro counties in the state of Ohio, and something that you all should be very proud of.
That took a lot of hard work.
It certainly did.
Appreciate that.
It certainly did. In addition to that, we sought to improve our participation rate in 2-parent households, setting a rather ambitious goal of meeting the federally mandated 90% limit, and we're very, very pleased to say that in July we reached that target as well. That's a 21-point increase from just January of 2015. And that 90% mark also is tops among all the metro areas in the state, even though we have a significantly larger caseload in that area than all the others. So we're very proud of that. We've maintained that 90% mark through the third quarter of 2015, and the staff will continue to strive to achieve that in 2016 as well.
Good work.
Of course, our ultimate goal is to assist men and women in finding meaningful employment. That is, jobs that pay a living wage so that they are able to move off cash assistance and become self-sufficient. Through the first 2 quarters of 2015, we, with the help of our many contracted providers, have assisted more than 780 program participants obtain employment, 67% of whom have been able to move off of cash assistance. As you know, we monitor those placements and are proud to report that more than 91% of those who are able to initially move off cash assistance stay off for 90 days or longer. That's very true, Commissioners. The strides that our agency has made this year have not gone unnoticed. Other counties, such as Cuyahoga, and this particularly pleases me,
And
have
me.
sought our guidance to improve their work participation rates. We even had visitors from the state of Maine, and in September hosted them here, a delegation of their State Department of Health and Human Services, to provide an in-depth look at how we were doing our business. He's out of order.
You know, placement is something, it's retention in a job that gets them to be off our benefits and onto living wage, sustainable positions.
It's very true. We're proud to be recognized for this progress, Commissioners, as you mentioned. We've made in workforce development, we remain committed to increasing the quantity and, more importantly, the quality of employment outcomes for program participants in 2016. That's from rate to great, right, team?
Yeah.
Accomplishment number 2, medical enrollment and expanded community health partnerships. As you know, since Medicaid eligibility was expanded, more low-income Franklin County residents and single adults have gained access to critical health care coverage in our community. As of September 15, more than 65,000 individuals have been enrolled in Medicaid thanks to the expansion, and nearly double the amount from the same time last year. So we're increasing at an accelerating rate. In total, there are more than 345,000 residents in our community that are in the Medicaid program. That's a significant number, and that's more than 10% than a year ago. Of those, nearly 160,000 of them, nearly half, are children 18 and under, so it's such a critical program. That's not to say there haven't been challenges. Earlier this year, the department worked diligently to reinstate an estimated 15,000 Franklin County customers that were erroneously terminated by the state. We were successful in doing so. And likewise, technology continues to be a challenge as the full rollout of the state's new eligibility system, Ohio Benefits, has been further delayed. We now expect the Medicaid portion to be done in 2016. And the integration of food and cash assistance is planned for the following summer. So until then, we'll continue to work within the systems we have, the 2 systems we have, both Ohio Benefits and the CRISI system, to process
And
Medicaid
those
applications.
2 systems don't speak to each other. Will they eventually?
I think the hope is that we transition over.
Yeah,
Yep,
Chrissy is so old.
30 years old.
Yeah.
Yes, I
Maybe
know.
even close to 40.
It may be.
Actually, yeah. So,
Fortunately, our agency has been able to build and strengthen working ties with a wide array of community partners, public, private, nonprofit, that allow us to further access, further reach our constituents across the county and touch the lives of more of our most vulnerable citizens and residents. This year, we have expanded our partnerships with other local agencies, and we now have satellite case managers at Children's Services, Columbus Public Health, Board of Developmental Disabilities, and the COAAA. We've also this past year partnered with the Mount Carmel Health System to provide on-site case managers at their West, East, and St. Anne's campuses. So that now takes us to 3 of the 4 major hospital systems in the region, and we're working on numbers.
so maybe we need those folks at the Foodbank and PrimaryOne as well.
Yep, and we can be happy
As
to
we
talk
sit here
about
today.
expanding those
Yeah.
partnerships even further,
Yeah.
Commissioner. It's a great point. And importantly, these health systems pay for the entire full-time employee costs for the on-site case managers, not JFS, so it does save taxpayers monies, and it allows them, but it allows those systems to increase their Medicaid revenues. Mount Carmel alone has seen its average monthly revenue increase by more than $760,000 and a 50 to 60% improvement in case approval turnaround since April. So it's truly a win-win partnership. We've also brought together Franklin County's local health systems and federally qualified health centers to develop and implement a strategy for combating infant mortality, as you are well aware, by increasing the number of women in childbearing age enrolled in Medicaid. We created a dedicated unit in medical support services to prioritize enrolling pregnant women and maintain direct lines of communication to address any case inquiries either from the centers or hospital staffs. By even the most conservative measures, we've made great progress here, as enrollment rates for pregnant women are up more than 17% countywide and more than 20% in several of the identified high-priority neighborhoods, and this is just since February. We're going to continue and ramp up those efforts even further in 2016. Accomplishment number 3 I wanted to highlight is our IVES timeliness. We've made a moral obligation to provide our customers with benefits and assistance. We also recognize and take very seriously our obligation to the residents and taxpayers as well. Our income eligibility verification system, or IVES, is in place to help prevent potential fraud or overpayments, ensuring that the proper benefit amounts are allocated to each family. Over the last 14 months, we've restructured our case change units, and we've revised our tracking process in an effort to meet those timeliness requirements. Our hard work has paid off, and in even the most recent state report for October, we had a completion rate of 84.8%. That's a 30-point jump from this time last year, and we've now exceeded the 80% goal for 8 straight months. So an example of the team working together to improve processes, to provide more services to our residents and in the right way.
And that's not being mean.
No.
It's being fair and making sure that people that do deserve the benefits have more money and can get those.
That's correct, and in a timely manner, Commissioner. That's the important piece. We want to make sure that those that are eligible for programs get them as quickly as we can.
Right.
So, accomplishment number 4, youth outcomes. Talk about the Learning Circle educational services a little bit. And in order to improve our funded youth programs, we've partnered with Learning Circle Education Services to gain access to their Learning Circle tool, which is an early warning indicator system used by Columbus City Schools that tracks youth trends and performance in attendance, behavior, and core academics. With our funding in part, Learning Circle was able to enhance their early warning indicator system with more information about school and community-based interventions, providing a more comprehensive profile of the student and greater insight into his or her individual needs. District staff and community partners utilize this shared data to better inform aligned learning strategies and supportive services that improve academic success. During the first year, all youth after-school, intervention, and summer camp providers received training on the tool, completed program improvement plans, and began developing collective strategies and best practices to improve outcomes. This school year, we are bringing additional schools and districts, including Whitehall and Reynoldsburg, into the partnership. Now Learning Circle reaches more than 50,000 students across 110 schools throughout the county. Whitehall at 19% and Reynoldsburg at 11% are among those districts that have the highest student mobility rates in the county. And so without access to this tool, it could take weeks, sometimes even months, for education officials to get the information they need or transcripts they need for these students.
Columbus Schools is still the highest mobility.
That, I believe that's true.
Yeah.
Yep, I'm seeing head nods from the team, yes. So now for many, including potentially at-risk youth, comprehensive student academic profiles, in essence, their digital backpacks, are accessible at a click of a button, and that's a very important service. Learning Circle data was also critical to the success of the More Than My Brother's Keeper pilot for at-risk African-American boys and young men on the South Side, allowing staff to monitor their academic progress and identify areas for improvement. By the end of the pilot program, 2/3 of program participants had experienced both accelerated growth in academic outcomes and positive behavioral growth, so it works. So our agency, these are just a few of the successes we've seen in 2015, but there are several prominent new initiatives coming forward in 2016 I want to briefly highlight for you. And the first is the Comprehensive Case Management and Employment Program, CCMEP. JFS will be a critical role and a critical player in the implementation of this new state system, which is set forth in the state's 2016-17 biennial budget. The framework for the program seeks to transition the current referral-based case management model to a more holistic or comprehensive case management model for the purpose of achieving quality employment outcomes for clients. That means more traditional social work, such as assisting clients with housing, transportation, mental health and addiction treatment, in addition to the services that we already provide. The program also intends to blend funding from Temporary Assistance for Needy Families and the new Workforce Innovation and Opportunity Act, or WIOA, to provide comprehensive case management services first to youth by July of 2016. Successful implementation of the program will hinge on strong collaboration, as you know, between this agency, the new Workforce Development Board, and the local Ohio Means Job Center, better known as our One Stop Center. Many of the rules and regulations that will guide this integration are still being developed by the state, and we will continue to keep you, the commissioners, apprised as we learn of them. Initiative number 2, Community Youth Development Framework. For many years, this agency, along with several other major funding entities in the community, have allocated resources to support youth programs and services. All too often, however, these entities operated in silos, utilizing a variety of different standards and metrics to evaluate outcomes, and sometimes even differing on what those outcomes ought to be. So JFS has embarked on a strategy to improve this practice by bringing everyone to the table, both funders and providers, to align resources and expectations in a manner that produces the best outcomes for youth in the community and the greatest return for taxpayer dollars. This broad-based community collaborative of more than 24 partners, many of whom you see listed on the screen or on your slides, are committed to defining a sustainable community-wide model for youth development for youth up to age 24. The idea here is not to reinvent the wheel, but instead create a framework to address the needs of both youth and families in the areas of academic success, social and emotional development, health and wellness, and family functioning and stability, all while drawing from available research, accepted best practices, and existing models. Additionally, this collaborative will provide an opportunity to assess programming and services already available in the community, and this will in turn allow funders and service providers to identify those gaps and align efforts and leverage resources in a collective approach that will make the best impact.
So good. Thank you.
And finally, issue number 3, reentry in 2016. We're looking, the department is to play a much larger role in improving the outcomes for individuals reentering society after incarceration. Earlier this fall, we established a new unit dedicated to assisting those and others involved within the justice system apply for public assistance. While we are still in the initial planning stages of this effort, the ultimate goal is to train a group of reentry case managers who will be responsible for assisting customers in obtaining and maintaining employment, in addition to referring them to the resources they need in the community. These case managers will be stationed on site at the courthouse a couple days a week and work with probation officers as needed from both the municipal and common police courts to connect them with services. We also will work with the community partners involved in the reentry sector to provide access to additional essential support services such as housing, transportation, mental health counseling, and more. This recognized support for infrastructure and access to wraparound services will reduce the potential for recidivism and will help more ex-offenders successfully reintegrate and make a positive contribution to the community. Our agency, commissioners, as you know, touches the lives of more than 1/4 of Franklin County's residents, whether it's providing access to public assistance, Medicaid, as mentioned earlier, subsidized child care, youth summer camps, or career training. Careful planning, increased collaboration and community partners, and the continued dedication of hundreds, literally hundreds of JFS employees, we are making a big difference in improving the quality of life of many thousands of our most vulnerable residents, families, and citizens each day. And we continue to support Commissioner priorities, your priorities in 2016, such as the new Homeless Task Force. We are not naive to think the challenges our customers face. We're not naive to the challenges our customers face, nor the challenges of our ever-changing work environment, but with your continued support and guidance, we will continue to increase efficiency, embrace creative solutions to become an even better agency, and be a vital resource to our community as well as a leader in the arena. Those, commissioners, are the conclusion of my prepared remarks. Let me just say 2 other things briefly. One, I want to make sure to acknowledge and thank the work of the prior director who did a lot of the work that I outlined today, Anthony Trauman. He had been a tremendous asset to this community, and I think he needed to be acknowledged. And secondly, let me tell you, wearing my other hat, how proud you ought to be of the staff out at JFS. They are tremendously talented, they work hard, they work smart, and most importantly, they work together. The department is in good hands, and we look forward to having new leadership in 2016.
Anthony also built a really good team. and
Sure did.
We appreciate that
So,
effort. Yeah.
so
Thank
thank you
you.
for me. Thank you,
Thank you
Commissioners.
all. Okay, next, MidOhio Foodbank. You're up.
Madam President, Commissioners, and distinguished officials, for the official record, I'm Matt Habash, the President and CEO of the MidOhio Foodbank, the largest of 12 Feeding America food banks in Ohio. On behalf of those in our community who are hungry, I appreciate the opportunity to summarize some key points here today. Start with, I want to share a story. We recently opened the Southside Roots Cafe and Market down in the Reeve Avenue Center, and during a community meal, I had the opportunity to meet 4 teenage boys who came in. First asked them why they were there, and they said that, Mom's work, I got to find dinner. And so they came to the center for our community meal, and they were actually playing on a little computer video game or something they had with them, and it was just, and went up and had a chance to have a conversation with them about what they were doing. And while they were eating, I think the most startling thing was they said, "This is really good," which, nice thing to hear when you're in a restaurant, and you provide a meal. But more importantly, they asked, "Can we have seconds?" And we said, "Sure. What do you want?" And they said, "Salad."
Great.
One of them had said, "I've never had a salad." He was a 14-year-old boy. So things we take for granted,
Exactly.
we're seeing folks that are saying and getting an opportunity because of the fresh food initiatives that we've been able to do. But sadly, 1 in 4 children in our community are food insecure. The long-term business and societal implications of hunger are truly untold. We know that hunger is afflicting our healthcare system, eroding the potency of our education system, and depreciating our competitive workforce. We're grateful for the community partnership of the Franklin County Commissioners, business, civic, elected leaders, and the thousands of individuals who help feed our hungry neighbors. To create a truly hunger-free and healthier community, we must do more to impact the health and well-being of everyone in our neighborhoods to help all thrive. No question, hunger is a community challenge that requires a community solution. In Franklin County alone, approximately 18% of residents and 22% of children are food insecure, meaning they have limited or uncertain access to nutritionally adequate and safe foods. Our neighbors are struggling with more than just hunger. Among households who seek food assistance, 22% have at least one family member in poor health, 36% have a member with diabetes, and 60% have a member with high blood pressure. 55% have chosen between paying for food or rent mortgage, and 69% have chosen between paying for food or utilities at least once in the past year. As a state, Ohio now ranks 3rd in the nation for families forced to skip meals or eat less because they don't have the money or resources to put food on their table. According to USDA report recently in September, 7.5% of Ohio households experienced very low food security from 2012 to 14. That's up from the state's 6.4% average from 9 to 11, and worse than every state but Arkansas and Missouri.
So that's post-recession. We're going in the wrong direction
That
in
is
the state of Ohio.
Absolutely correct.
Wow.
The report also found that Ohio ranks 6th in the nation for food insecurity, more broadly defined as households facing uncertainty or limited ability to provide food. Between 12 and 14, 16.9% of Ohio families' households face such struggles, up from 15.5 from the previous years. The nation's national food insecurity rate was 14.3% between 12 and 14, down from 14.7% the previous 3-year period. We're going the wrong direction from the rest of the country. When our neighbors find themselves forced to choose between food or a roof over their heads after a sudden job loss or an unexpected illness, MidOhio Foodbank and our partners are there to offer help in the form of nourishing food. Last year, the Foodbank served more than 500,000 hungry neighbors in our 20-county service area. Half of those were in Franklin County. If you take anything we do at the Foodbank, if you take any of our system-wide numbers, cut them in half. Franklin County is 50% of everything we do. Our Get Fresh perspective is about shifting a business model towards fresh food. In fiscal year 15, of the 58.3 million pounds of food we distributed to our hungry neighbors, 24 million pounds were fresh, nutrient-dense produce. Our fresh perspective on our hungry neighbors, 80%, and this is a startling statistic, we now have a tracking system tracking our clients. We're about 80% built out in the system across all of our food pantries and starting to put our produce markets in as well. 80% of the people we serve at a food pantry came 5 times or less last year. We have this idea and image and this myth that people come and they come and they come. 80% of the people are coming less than 5 times. So they're coming only when life happens and something interrupts and they have to step in and they have to go ask for help. 50% of our hungry neighbors we serve earn an income but are struggling to make ends meet. I think about half the people we help are working. And somebody in that household's working. That is it. My 32 years of being around in this work, that is the most amazing shift in this.
Yeah, our wages, we have this disconnect.
We have an absolute disconnect. In fact, we've done some work recently, and we're working on the South Side more and more, and one of the questions that I've raised at the Kerwin Institute is rather than track jobs, let's track the wages. If you look at the wages that were on the south side back when the steel mill and all the other industries were flourishing,
Good
what were
jobs.
those wages? They were
Right.
good jobs in relationship to the rest. What are the wages of the jobs today? In fact, we at the food bank decided that if I was going to talk about that so much, I wanted the moral imperative. So a year ago, more than a year ago now, we asked our board to raise our minimum starting wage to $15 an hour. So
Thank you
everything
for
we
that.
do is at 15. And
Amazingly, we don't start at $15, and Franklin County should. For every single employee, it should be a minimum of $15.
It's the fastest way to deal with most of our issues. We know that, and we've got to really work to convince the community that that's the case. Get Fresh also deals with a lot of misconceptions. I think one of the things is SNAP. Everybody thinks SNAP's rife with fraud. It's probably one of the most best programs, and I really want to applaud. I got to tell you, I mean, we do the Ohio Benefit Bank, and I get to work with my counterparts around the state and with our state association. And the team here, you ought to be really proud of your team. We are the only one that has the electronic transfer from people that are coming in from Ohio Benefit Bank. We are getting the benefits to people as we in the community are able to connect people to this resource faster than anybody else. So I applaud your team. You're doing great work.
And Matt, people seem to think that people that are hungry and coming to you are city folk only. We know that's not true.
It's absolutely not true. In fact, one of the things I'll talk about in a minute is hunger in the suburbs. You'll see it throughout the suburbs, and we're now going to put the tracking system be able to show you. We can show you by census tract or by block tract inside a census tract, how tightly the situation is in a lot of our communities that we take for granted.
People lost their 401ks during the recession, and they were sort of on that cusp of retiring. And that happened greatly in great amounts in our suburbs. It's terrible, and it's impacting now.
If you think about somebody losing a job in a two-income household and you're in the suburbs, you just took
Half your
the
income's
budget
gone.
you had and cut a lot of income out of it, but you still
Sure.
have the same mortgage, you still have the same car payment. You can't quickly divest yourself of those assets, and we think that's easy to do. That's extremely difficult to do. One of the unique things we've done, we now have 2 urban farms. So we started one on the south side at Clearfield Elementary. We just opened our second farm on the Hilltop. And we're partnering with, and as well as open the Southside Roots Market and Cafe at the Reeves Center, along with a, community kitchen where meals are prepared for children, attending the Southside Learning Center, and nearby Boys and Girls Club is on the 3rd floor of that building. And we do a free community meals, all coming out of one kitchen and a low-cost market that we've put in that space for people to buy produce at a lower price point and get fresh milk and eggs right in and we don't care who shops it. It's a great place to go have lunch. I got to tell you, the food is fabulous. We've absorbed a soup kitchen into the middle of that, so 75 people have a loyalty card. You can't tell. They swipe their card the way you and I would swipe our credit card, and we're able to provide them a meal. And we've already seen this amazing transformation of people in the short 7 weeks that we've been open. Just people coming in because they're having lunch with all of us, with everybody coming together. It really is an opportunity we call practicing third place, where you gather your home and work, first place, second place, third place is where you gather. Will you gather across demographic lines? That space is making that happen. And then all the other nonprofits that are in that space and government agencies that are in that space give us the ability to take a holistic approach. So it truly is trying to live into its, its hub of hope, mantra, and really see if we can actually make that happen. But Fresh is where we are. I mean, and you guys have been an amazing help, and I'll talk about that in a second. But the disconnect is that there as high as 14 billion pounds of produce are left in the fields in the United States every year. Now, to put that in perspective, there are 200 food banks part of Feeding America, and we're collecting about 1.4 billion. We've gone from 350 million over the last 4 years to 1.4 billion, so we're going up fast. But yet, there's a lot more opportunity there. We still have one in 6 Ohioans don't know where their next meal's coming from. And the fresh food, we're the opposite of the grocery store. Fresh food's the economical thing I can do. It costs us about 17 cents a pound to bring fresh produce, even as far away as California. When I go into the marketplace to buy canned goods, it's 55 cents a pound on average. So I can get almost it's a 4 to 4.5 to 1 ratio, saying it's the opposite of the grocery store. Healthy food is the most expensive because we're working with the farmers, capturing the grade Bs, capturing their inability to sell some of the product that they have, paying their workers an extra day's wage or two to get it out of the fields, and than
Yeah.
trucking it from wherever it is right here. And we have one of the best programs in Ohio. I give Ohio State government really a lot of credit. We're up to $20 million. We got an increase to help bring in more produce from the state of Ohio. That leads the country in terms of partnering with food banks. So
That's good.
it's been around a long time through a lot of governors, and it's continuing to provide us some additional resources. In fiscal year 15, working with community partners, we grew the program and held 680 markets in Franklin County alone. So that's 6.6 million pounds of fresh food making it into the hands and homes of low-income families who need it most. In collaboration with our network of amazing agency partners, our goal in fiscal year 16 is to bring 1,400 produce markets to life in our local communities here in Franklin County. So we are looking at a huge increase. The produce is there, and if we can figure out how to get it here and get it to people, and I'll talk about the additional benefits of that with one of our fabulous partners here, PrimaryOne. Funding from the Franklin County Commissioners ensures 72,000 unduplicated low-income food insecure individual residents of Franklin County have access to 9.5 million pounds of fresh food via the 1,400 markets, held at 120 different produce market locations. So this is getting, we call it right food, right time, right place. You know, get the food where we can, right into the community as quickly as possible, bring it in. It's in our building less than 48 hours on average. You know, it's get it out. I often tell them it's fresher than most of the grocery stores have because it's coming straight from the farms into our building and back out as quickly as we can. In 2013 to 14, the food bank surveyed nearly 1,000 produce and mobile market clients, and we found out some things. You know, 94% of our clients are increasing their fruit and vegetable consumption by 2.5 cups per day. I got to estimate that's better than all of us, you know, in terms of what we're doing.
Sure.
So we're getting it to them on a more regular basis in the times that they can use it. But they also told us, 84% of them told us the one biggest reason they do not consume more fruits and vegetables is they simply cannot afford it at the grocery store. This is about cost. So as we look at access to food and food deserts and all those issues, remember the primary issue first is cost of food. Then it's location of the store and transportation and all the other. You don't have any money, it doesn't matter where the store is.
Right.
And I know you offer some cooking classes too. Is that part of it?
That's part
as
of this.
well?
We've partnered with some other partners in the agencies to do that as well. We're partnering with OSU Extension. We've had our own crock-pot cooking classes, teaching people how to use crock-pots. One of the discoveries out of that is people often don't have a good knife. You give somebody an acorn
Right.
squash, you know, it's
Oh,
really
yeah,
hard to
that's
cut an
pretty hard to
acorn
cut.
squash if you don't have a good knife. So we're learning, you know, what we take for granted. You know,
Yeah.
one of the realities, I did the food stamp challenge. The food stamp challenge is eat on $4.02 a day. You know, and as hard as that is, the thing that I learned the most was the privilege that we all have for free meals.
You know, I think it'd be great if all 3 county commissioners accepted that challenge for just 1 month and tried to live on that $4 and how many cents?
$4.02 a day,
$4.02
$1.34 a meal.
a day. I'm willing to do it. I think, you know, that would be a real eye-opening experience.
If you do that, I would encourage you to write about your experience. Write about your
Absolutely.
experience even shopping
I'm
for
in.
the food. and
I'd
what it-
invite
the
Marilyn and
choice-
John to join me.
And you'll find you won't buy much fresh fruit and vegetables in that
Oh,
model
for
because you
sure.
simply can't afford it.
For
So-
sure not.
But with the critically needed food bank programs like produce markets, hungry Ohioans will suffer, especially the most vulnerable community. For example, food insecure children learn more slowly than their peers and have more cognitive problems, higher levels of anxiety, and poorer health. Food insecure seniors are 53% more likely to report a heart attack and 40% likely to report an experience in congestive heart failure.
Wow, could you repeat that again?
Food insecure seniors
Yes.
are 53% more likely to report a heart attack and 40% more likely to report an experience of congestive heart failure.
Oh, my God.
Talk about our,
Cost alone of that,
we really,
human cost and
Greg and
medical.
I forgot to introduce both Greg Winslow and where's Alex and Marilyn are all here as part of our team. And Greg and I were talking yesterday, you know, what business are we really in? It really is the healthcare business.
Yeah,
You
sure.
think about providing people food, even
Oh, it
30 plus
is
years I've
health.
been around.
There's no question it's health.
And so we have formed this amazing partnership, you know, because of the diabetes research that we did a few years ago. We were one of 3 food banks in the United States to do diabetes. They just published it, so we finally can talk about it. It was in partnership with PrimaryOne, and it was in partnership with the Central High Diabetes Association, because any PrimaryOne diabetic gets directed immediately to CODA, you know, and we partnered together. They were deemed food insecure, and the 3 of us worked together. And the amazing things out of that, not only did we see the best improvement of A1Cs using that model, so the A1C is the blood sugar
Right.
measurement, we also saw that 60% of those clients were suffering from depression not knowing where their next meal was coming from. And you
Sure.
could make that go away in the year they're on the study. And we also learned that even at federally qualified health centers and other primary care facilities, they don't screen for food insecurity. It wasn't as part of the system. It now is part of the system. We are writing food prescriptions to the produce markets with the docs, and I got a little bit of early information 2 days ago from the West Side site that we did the diabetes work at. We're already, in the short period of time we've started writing produce prescriptions, seeing a drop in the A1Cs. So we're seeing the healthcare. So your point about costs is absolutely true, and we believe we can use fresh food in partnership, together to really have an impact. So we're going to strengthen, and we've been trying to teach the rest of the country that the key to this are the FQHCs, because we're already doing with the hospitals and with Mount Carmel, and having JFS there is a big deal. But we believe
Need them
anybody
down
that
at
we
your
can
place.
create a model that's different. We also think it's really important, and that all the work that's going on around basically case management now, however you label it, from the state of Ohio to United Way working on a pathways hub, to all of us coming together saying,
Sure.
we have to do a better job of making sure every community care worker knows how to access the systems that are available in a way that works for the person they're working with.
Yeah.
Is Jeff Beal working on that
Jeff is
with
working
you?
that with us, and it really is a case that, we're really trying to step into this. How do we do this holistically? Because none of these issues are isolated. If you're hungry, it's because you have a lot of other issues, starting with your wages and working your way down. If you're paying 50% of your income on a house, that has an impact on the rest of your budget.
Yeah.
Matt, I'm really struck that, again, going back to that heart attack and congestive heart failure, that's what my dad died of. And for 20 years, he ate a hot dog every day to save money.
I can relate. That's what I bought when I was on the food stamp challenge. Over the past 30 years, to your point, Madam President, we've seen an increase in hunger in the suburbs. Places like Worthington, Westerville, and Dublin. You would not normally equate that with food pantries. We have very large food pantries.
Right.
Fortunately, there's only one, and we've got a way of bringing people in. Worthington actually has 3, but we've continued to look at all of going around Gahanna. Hilliard now has a food pantry. We have a big pantry in Grove City.
I know.
So you go around the outer belt, and you're continuing to see that. But we believe we can make a difference if we can all come together, and we really can create a hunger-free and healthier community. Your decades-long partnership with us has been invaluable. The grants you gave us to acquire the 4 trucks was the beginning, in partnership with the private sector, was the beginning of really ramping up the produce. We had the asset to get the product to them. If we couldn't get most of our agencies are small, they don't have the ability to pick up product. Our ability to get it to them, get it to the markets in a just-in-time model is absolutely invaluable. The current proposal will support the direct distribution of more than 9 million pounds of fresh, nutrient-dense produce to approximately 72,000 low-income residents. It's only when government, business, and charities come together that we can hope to end hunger, one nourishing meal at a time, and co-create a sustainable community where everyone thrives. Because remember, the enemy is hunger, not the hungry person.
You're
Exactly.
right.
Thank you.
So true.
Thank you for your passion and caring. I think, whatever you asked us for, we ought to double it. It's
We
my
can do
view.
that. Just a final pointer, just around, if you guys find extra money, here's what we're going to do with it.
Yep.
I asked my...
That's good.
Everybody else around here.
Absolutely.
Families are spending all the years they spent on the other side listening to these
That's
requests.
serious.
But the reality is, I asked my team to go back and analyze. I said,
Yeah.
do we have capacity left in our system to do more? The team came back and said for another $400,000, we would distribute another 1.6 million pounds of produce that was a variety of produce that added to the variety to get even more fresh fruits and vegetables. So anybody finds
we
any
go.
extra money, we're looking over above what we already have to raise. We're looking for another 400,000. We can do another 1.6 million because the product's there. This is
And
not, it's just sitting in the fields rotting.
It's sinful that it's sitting in the fields rotting.
That's
It
what I'll do
is.
with extra money if you
All
can
right,
find that.
so
Thank you.
let's work on that.
Thanks, Matt. Welcome,
Thank you.
Senator Tavares.
Thank you very much. Good morning, Commissioner Brown, Commissioner Brooks, and O'Grady. As you know, I'm Charlita Tavares, and I'm here today in my capacity as the CEO of PrimaryOne Health. I want to introduce my colleague, Dr. Jeff Marable, who is the OBGYN and Women's Health Medical Director, who will be presenting with me. And I also want to introduce our colleague, Dr. Parminder Bajwa, who is the Director of Clinical Excellence. And we are here presenting on behalf of our board chair, Dr. Kevin Dixon, and our 14 members of our board of directors who represent the community. And 51% of our board, as you well know, have to be patients of our PrimaryOne healthcare system, which is a good way of doing business because you're hearing directly from those you serve. This has been a busy and exciting year for us, and I'm pleased to be able to share some of the highlights. In particular, I want to update you on the progress we have made in the area of women's health, which is made possible through the grant you provide to PrimaryOne Health. As many of you know, we changed our name this year. We were formerly known as Columbus Neighborhood Health Center, Inc. We celebrated our 18th anniversary on last week, I believe it was. It's going by very quickly. I came on in February of this year as the CEO, replacing our longtime excellent CEO, Tom Horn. And so now we have a new brand because we have 10 sites in Franklin and 10 total, one in Pickaway County, and then 9 sites here in Franklin County. PrimaryOne Health is a level 3 patient-centered medical home recognized by the National Committee for Quality Assurance, the highest level of recognition on quality. PrimaryOne Health's #1 goal is to enhance and maintain the health of the patients we see every day. We are committed to quality care and improved health outcomes for all of our patients. Along with the expansion of locations in the past years, internally we have developed our women's health program, behavioral health program, pharmacy program, and nutritional program. We have continued our focus on women's health, particularly in light of the community-wide focus on infant mortality. The funding you provide to us has enabled PrimaryOne Health to continue to serve some of our community's most vulnerable women and to ensure that the care is of the highest quality. PrimaryOne Health served over 2,350 active OB and 4,574 GYN patients last year. In 2015, we have already seen more than 2,311 OB patients and 5,620 GYN patients. To meet the increased demand of patients, we have hired more women's health providers, totaling up to 10.
Excellent.
There are 3 certified nurse midwives and 5 women's health certified nurse practitioners working in collaboration with 2 physicians taking care of patients with complicated medical histories. An additional provider, we were talking about that extra money, an additional provider to support the existing team will help
I think
us.
we should double them too.
An additional provider to support the existing team of 10 would help us to take care of our growing number of patients and continue meeting the quality standards. To reduce infant mortality and maternal health problems, we know that early prenatal care, that is, care beginning in the first trimester of pregnancy, is essential. As mentioned earlier, we have already seen more than 2,311 OB patients. More than 67% of these women have access care during their first trimester.
Great.
Once enrolled as our patients, pregnant women have access to an array of supportive services to include pre- and postnatal education.
And food?
Absolutely, absolutely.
Nutritious food?
Absolutely. We have a great partnership with MidOhio Foodbank.
I know you do.
Patients are followed with well women exams, contraceptive counseling, and same-day, long-acting reversible contraceptive insertions, otherwise known as LARC. We provide ultrasound services at 3 of our locations, non-stress test services at 2 locations, and we provide colposcopies and leaf services to our patients who are at risk of cervical cancer. We would like to add another ultrasound and non-stress test to our services. This would allow us to provide high-quality services to all of our larger sites and in each quadrant of the community. We have instituted an OB intake nurse program at almost all of our locations where we provide women's health services. This collaboration with Columbus Public Health allows the nurse to schedule intake appointments for OB patients. The patients are triaged and schedule an appointment with the provider within a week.
That's really good.
It is.
Oh my gosh.
It is.
Wow.
It has helped to reduce the waiting time, which is much less than other providers. Every pregnant woman seeking care is first scheduled with a nurse specialist who conducts a comprehensive intake interview to assess all aspects of a woman's life, particularly in those areas which may have negatively impacted her pregnancy. Once identified, the nurse specialist is able to respond immediately with education, information, scheduling, and other supportive services in order to reduce barriers and increase the likelihood of a positive birth outcome. Employees have also been actively involved in the Southside efforts to reduce infant mortality through collaborations with Columbus Public Health and the Ohio Equity Institute project. We continue to focus on assuring that babies born to PrimaryOne Health patients are healthy. 91% of the babies born to PrimaryOne Health moms this year have been of a healthy birth weight.
That's excellent.
It is. And 81% of our OB patients have had their postpartum appointment with us.
Very good.
That's very high. We are encouraged by the community-wide focus on this issue. Many of our staff and providers have been involved in Celebrate One and Ohio Better Birth Outcomes Board, steering committee, work teams, subcommittees, and other activities designed to address the issue comprehensively and systematically.
And we've been, of course, investors in both of those, so thank you for carrying that work on.
Absolutely. It takes all of us.
It does.
Not one organization, not one system, not one area of one's life can totally determine the health of an individual, and that gets to our social determinants, whether we have food and transportation and housing. All of those issues are known as the social determinants of health and impact greatly the health outcomes of each and every one of us, but more importantly, the outcomes of those infants that are born to moms who don't have all of those services provided.
Please excuse me, I have an appointment with Judge Sargis that
Understand.
I can't delay. He's got a trial that I can't delay him.
We understand. Thank you.
Thank you.
We'll carry on here.
Integration of behavioral health services and prenatal care has been invaluable. Many women struggle with addiction, are subject to violence in their relationships, and experience mental health challenges. We offer depression screening to all of our OB patients. We are expanding our behavioral health services to all of our locations, and some level of behavioral health services are offered at all of our locations. In partnership with The Ohio State University Wexner Medical Center, we are now providing several specialty services at our 1905 Parsons Avenue location, which is the John Maloney Health Center, including cardiology and physical therapy, GI services, and dermatology. Offering these types of services is unique among federally qualified health centers in Ohio, but even more so in the nation. PrimaryOne Health is proud of its collaborative work with the MidOhio Foodbank and the Central Ohio Diabetes Association to provide fresh produce, cooking demonstrations, diabetes education, and nutrition services. And our collaboration with the Franklin County Department of Job and Family Services and our certified application counselors who have also been trained to be community health workers to enroll women, men, and children in Medicaid or the market exchange, and they're busy with their work right now.
So you already have that covered?
Yes.
Primarily, good.
Yes.
Good.
We are quite proud of the success we are seeing in our overall clinical outcomes, and I cannot stress enough how much your funding contributes to that success. That's why the support from the Franklin County Commissioners, the City of Columbus, and federal government as partners is so critical in the work that we're doing. With your support, pregnant women are receiving prenatal care during the first trimester, learning how to best care for their babies and delivering healthy babies. I thank you for your continued commitment and support, and once Dr. Marable completes his presentation, we would be more than happy to respond to any questions.
Good to see you again, Doctor.
Likewise, thank you. Good morning.
Good morning.
Thank you, Charlita. Good morning, distinguished commissioners. I want to discuss briefly what PrimaryOne Health, along with our partners, are doing to reduce infant mortality in the greater Columbus area. As of the end of October of this year, we have 280 women who accepted progesterone medication to prevent the onset of preterm labor.
Great.
Our target goal for 2015 is 317, so it appears that we are well on our way to achieving this goal. This, compared to last year, demonstrates a 15% increase in women who receive medication and a 42% reduction of those who decline treatment compared to this time last year.
Very good.
In addition to, the operations team has hired a marketing firm to create progesterone and reproductive health educational materials that will be distributed to patients and providers, emphasizing the importance of using progesterone for those patients at risk and its direct relationship in helping to reduce preterm labor. For 2016, the progesterone work team, of which I am part of, as well as our prenatal care and reproductive health team, have been charged with identifying high-impact opportunities to move the needle. We will be looking at a number of initiatives that will be ambitious yet achievable. Some areas we are exploring include: how do we increase the percentage of eligible women receiving progesterone?
And the cost of that is very low.
Correct. Well, it is very low. We are always faced with the possibility of some pharmaceutical companies who would like to change that.
Yes.
And so there's a constant battle in making sure that not only is it accessible, but it's affordable to all those who need.
Yes. And we hope we're winning that battle.
Absolutely. Absolutely. How can we also reduce the number of early elective deliveries that contribute to neonatal intensive care admissions, which can lead to increased infant mortality? How do we address some of the social determinants, as Charlita mentioned, such as tobacco use, food insecurity, obesity, and sexually transmitted infections, which disproportionately affect those who live in the so-called targeted areas? And finally, how can we expand opportunities to look at other aspects of prenatal care, not just progesterone? So these are just some of the few challenges we look forward to addressing over the remainder of the year and during 2016 to help reach our goal of reducing overall infant mortality and to reduce the racial disparity that exists between Caucasians and African American babies. With all of us working toward this common goal, PrimaryOne Health, along with our partners, can make Columbus a city that we can be proud to live in and to raise our children.
That's great. You're all working so hard on our shared mutual goals, and we're making progress. We just have to do so much more in order to significantly battle what you've all just described today in terms of infant mortality and food insecurity, but together we're doing that. Just a question on the infant, prematurity issue. Several years ago, we kind of kicked off a community-wide and even statewide Better Birth Outcomes program on the progesterone. Dr. Maribel, do you see this as being a significant impact? Dr. Long and other experts on infant mortality, Dr. Ortiz, our coroner, unfortunately tell us that premature birth is still the leading cause of infant mortality in our community. So the progesterone is such a huge central part of what we need to be doing. Are we doing enough?
You know, I think there's always an opportunity to do more. Mm-hmm. Certainly we're doing much more than we were just 4 or 5 years ago. The importance of using progesterone is that we know that it works. Mm-hmm. This is evidence-based that's been shown to be true. And the nice part about it is that Ohio State, we have a lot of organizations right here in Columbus that has worked very hard to show how important this medication is in reducing preterm labor and subsequently preterm delivery. Progesterone, for those who may not be aware, is a hormone that is involved in the menstrual cycle but as it relates to pregnancy, is a key hormone that is involved in allowing the pregnancy to maintain itself. So without adequate progesterone on board, there's a higher risk of premature contractions, preterm labor, and subsequently preterm delivery. So it's important that we have these the hormones available to all those that are in need, and we have to make sure that those patients become aware that we have it readily available and that we can distribute it on a dime's notice within a very specified period of time before it's too late. If we capture them early, we're much more likely to be successful. And so part of our goal is to make sure we get the message out there to allow the community to be aware of this is a very important medication. We can make a difference in your pregnancy.
Well, and thank you for that answer, because we're now engaged in funding a rather large effort called Celebrate One, and it talks about the ABC, alone, on the back, and in the crib, and that's about safe sleep. But we haven't really talked about communicating, as you say the need is, the progesterone, and it's a little more complex to talk about that and a very targeted audience, but maybe that's something else we could collaborate on, helping with that communication.
Commissioner Brooks, thank you for that. Celebrate One is an important aspect of reducing infant mortality, and the ABCs are critically important as one of our partners. We also have other partners that are helping us on the total picture in reducing infant mortality. Moms to Be, which is another collaboration with the Ohio State University, and we will start a centering pregnancy program in the first quarter of 2016, which will complement the Moms to Be program, because again, it's offering support to pregnant moms so that they learn from each other, and they talk again about nutrition with Moms to Be and help each other with recipes and cooking demonstrations. And then the Centering Pregnancy is the support network that continues throughout the pregnancy, so that if a pregnant woman understands that there's something going wrong, they can share that information with each other, share ideas of how to have the best pregnancy, the best outcome.
And Dr. Kelly Kelleher, who kind of has been the lead researcher on premature birth at Ohio State, progesterone, better birth outcomes, also has shared with commissioners on numerous occasions that vitamin B is missing in most of our diets, and particularly for young women of childbearing age. If we could, better coordinate the food intake to make sure that vitamin D is heavy in content for those of childbearing age, but also, supplements where that can't necessarily be effectuated. So would just like to throw that out and think about it. We have another relationship with the charitable pharmacy, and that might be another collaboration that we should discuss with you all.
Thank you. If I just may say one more thing, when you think about the food insecurity and how significant that is in our communities and how it relates to preterm labor, our teenage patient population is particularly affected by not having enough to eat, by not having the financial means to be able to get the necessary nutrients to have a healthy pregnancy. The infant mortality rate in some of those zip codes that are at risk can be as high as 18 or 20 per 1,000 babies. We are failing our children.
Yes.
And so we need to do everything that we can to get those numbers reduced. Progesterone is one component. Safe spacing is another component, so that you're not getting pregnant shortly after having a child. That puts you at increased risk of preterm labor and delivery as well. And of course, safe sleep, making sure that those precious children who are born have their proper crib and are placed on their backs correctly and alone, not with so many of their toys and different elements that we were so used to when we were growing up.
it's
All of this
changed.
is important if we're going to make a difference, but we're committed into making sure that all of our babies make it to their first birthday and we reduce the infant mortality rate.
Well, that's a wonderful, comprehensive note to end on, and a challenge for all of us. $4.02 a day. I don't know any teenager that could limit themselves to that, and any pregnant mothers. So we all have a duty to do something more. So thank you so much for what you do.
Thank you.
Thank you. Thank you all. That concludes our hearing.
Is this-